Greetings from Blockbuster News from BlockPro. Here is the latest news in cardiology compiled just for you in a small video capsule. Here are the headlines. Rationale of the inclusion of beta blockers among major antihypertensive drugs in the 2023 European Society of Hypertension Guidelines. A systematic review and meta-analysis studying beta blocker efficacy for intra- and interdialytic hypertension patients. In the technology section, use of artificial intelligence in improving outcomes in heart disease. A scientific statement from the American Heart Association published in Circulation 2024. Now, the news in detail. There has been a lot of talk about beta blocker inclusion in latest 2023 European Society of Hypertension Guidelines. This review article from Hypertension 2024 addresses the reasons why, unlike other guidelines, in the 2023 guidelines of the European Society of Hypertension, beta blockers have been regarded as major drugs for the treatment of hypertension at the same level as diuretics, calcium channel blockers, and blockers of the renin-angiotensin system. The reason is beta blockers 1. Reduce blood pressure not less than other drugs. 2. Reduce pooled cardiovascular outcomes and mortality in placebo-controlled trials, in which there has also been a sizable reduction of all major cause-specific cardiovascular outcomes. And 3. In several comparison trials in which the protective effect of beta blockers versus the other major drugs has been similar or even greater. The authors expressed criticism against the exclusion of beta blockers because of their lower protective effect against stroke. The review concludes, these partial data cannot replace global benefits as the main deciding factor for drug choice. Also, because in the general hypertensive population, whether and which type of event might occur is unknown. The next important article is a systematic review and meta-analysis from March 24 issue of International Urology and Nephrology studying beta blocker efficacy for intra- and interdialytic hypertension patients. Intradialytic hypertension affects 5 to 15% of hemodialysis patients. Beta blockers can be preferred as antihypertensive drugs due to their superior blood pressure control, decreased risk of cardiovascular events, improved endothelial cell function, and decreased noradrenaline levels. The review concludes, beta blocker treatment resulted in significant reductions in post-hemodialysis systolic blood pressure among intra- and interdialytic hypertensive patients. And now, news from technology in cardiology. Use of artificial intelligence in improving outcomes in heart disease. A scientific statement from the American Heart Association published in Circulation 2024. The American Heart Association supports the creation of tools and services that would further the science and practice of precision medicine by enabling more precise approaches to cardiovascular and stroke research, prevention, and care of individuals and populations. The application of AI, ML in different areas discussed in the article are imaging, different modalities in cardiac diagnosis and prognostication, cardiac treatment planning, stroke diagnosis, prognostication, and treatment planning, electrocardiography to scale current expert capabilities to read ECGs beyond trained experts. The other topics covered are in-hospital monitoring, implantable and wearable technologies, genetics, interpreting EHRs, and much more. Several challenges exist, and few artificial intelligence tools have been shown to improve cardiovascular and stroke care sufficiently to be widely adopted. For more such interesting news in the field of cardiology, tune into Blockbuster News from BlockPro. For more details, please contact our IPCA Cardinova representative. And stay tuned for the next episode of Blockbuster News from BlockPro.